broadcasting or? YouTube will, yeah. YouTube start. Okay. Cool. No, straight in front of you. In front of you. No, no, no. To your, in front of you. Yes. No, 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 no.
Joint health is going to be at Camden.
That's for you. Her and Sherry can flip on and off. Sherry will sit to your left. Yeah, I'm gonna set. I'll just set. Unless she wants to come down. That's fine. You're good.
I'm happy wherever.
Okay. Then all you. I was trying to make.
I'll just take that one back.
There you go. That works for me. I will get out of your way.
Oh, you are great. Thank you.
Rotate.
We'll call this meeting of the Legislative Oversight Commission on Health and Human Resource Accountability to order. It's not running? It's on.
Yeah.
You just couldn't hear me. Okay. We'll call this meeting of the Legislative Oversight Commission on Health and Human Resource Accountability to order. The clerk will take a silent roll call. We do not have a quorum at this time. Okay, we will proceed to our presentation today, which is a discussion of the Office of Shared Administration, and Dr. Sherry Young is here today to do that. Welcome.
Thank you, Chair, and I appreciate everybody coming out and taking time in Parkersburg for a discussion about OSA, the Office of Shared Administration, between the three different offices and departments. First of all, I wanted to provide you just kind of a background of how we got to where we are, just reminding that from House Bill 2006, we were named into three different departments as of July 1st of 2024. I'm sorry, of January 1st of 2024. The OSA was formed out of that legislation from which we will be providing quarterly reporting, and we will be giving updates of how things are going. So today is more of a conversation of where have we been, where are we going, and really what's working and what isn't working. So some specific questions that came out that I'll be going over are those things. What changes have we made? What improvements have we been able to do? But what are some of the challenges that we still need a little bit of work on? Just to point out too, we do because of the bill and the way that OSA is shared, we do have an MOU that we share between the three distinct departments and the Office of Shared Administration. The timeline here, if you look, 15 months has gone very quickly in some ways. The three new secretaries being named as following the approval of the bill, House Bill 2006 being approved in March of 2023, the new secretaries being named as of May 24th, getting to work about July 5th of the same year. And even though we had about 6 months of runway before we took off with the new departments, there was a lot of work to do. There's a lot of great things happening that I'm going to highlight today and some of the challenges that we've had. But even further than that, for the Office of Shared Administration, we had another 6 months of runway to take off. And so officially, OSA has only been locked in its seat and ready to go since July 1st of 2024. So we were about 70 days in. We are working on our first quarterly report, and I would love feedback today as to what else you would like to see. What are the things that we can do to get more efficiencies, and have that conversation today as far as what we can do moving forward. But even with 70 days in, we've had a lot of wins and a lot of efficiencies and some heavy lifts in other places. If we had to give a percentage, we're over 80%, but we still are committed to getting that work done. Now, as you recall, for the Office of Shared Administration, there are 6 separate offices, first being Communications, Constituent Services, Finance, OHRM, Management Information Systems at MIS, which is our technical field that keeps us going on a daily basis, and Operations. I wanted to share with you today the organizational chart. And so we had a great discussion back in December, getting to know the directors of each of these offices and what are the functions and do they or don't they belong within shared administration? Are there some efficiencies that we need to lock in at that point? At that point, we have taken what was in the language and taken these offices, and it was felt at that time that this is where they rightly belonged and that they were able to serve all three departments as they continue to do. We had the office directors there, and sometimes it's better to hear directly from the directors as to how are things going. It was a great meeting. I would put that up as an option again if you're interested in coming to talk to the directors and learning more about how OSA is going from an additional perspective. So for our Office of Finance, you know Tara Buckner. She's worked on all of our finances and our budgets. She works within the Office of Finance as our CFO. We have the Office of Human Resource Management, Angie Ferris. She is still there and doing wonderful things within HR. We have John Lopez, who has interacted with a lot of you. He is a great touch point as far as if a legislator has someone that reaches out to them for services. Even I have times that I ask John how to navigate into the other departments and bureaus to help get services for individuals. Yesterday, we had an individual who reached out because they had a wheelchair at another facility, was moved to a hospital, and then into another nursing home. Sounds like easy things, but these are not the easiest to navigate always. But having those touch points and understanding where we can help people and have that opportunity makes a big deal. So a lot of you do know John and his great work. For the Office of Communications, we have two directors kind of by design. So one of the things that when we started with a central office of communications is that it was very difficult to get things out and get things worked all the way through the bureaus because they are doing the fact checking. They are the subject matter experts. They are getting the information, correct information from down inside the bureau. So we very intentionally, and I'll talk a little bit more about how we structured it later, but we do have two directors so that we can work deeper into the departments. But we have a director for the Department of Human Services Communication. We have Whitney Wetzel, and then we have Annie Moore, who is new to us. We had Jessica at the time that you all were visiting. She is the director and doing a great job for Department of Health and Department of Health Facilities. Also, we have Brian Rosen. That is a change in staffing for our directors since the visit back in December. We had a retirement from George Montgomery, who had been with the office for many, many years, but Brian doing a wonderful job. You did have the opportunity to meet him because he spoke a little bit about procurement and the purchasing process. So he was a great fit to into operations and doing great things. And then the last office, but not least, we have MIS, and the director there is Sean Charles. During that meeting, you may recall he was the one, his daughter was having a baby, but still committed to the piece and committed to talking to our legislators to get that information out there. One of the things I was asked was how many FTEs are we? Are we at a net balance? Are we at a gain or a loss? Well, when I talk about the FTEs, for OSA in December, we had 424.66. And you see this 0.66 on there. These are not individuals. These are positions. And so the positions may be somebody is part-time, and that's where you get the 0.66, or somebody can be near part-time, and you can be anything from a 0.2 to a 0.25 to a full 1.0 FTE. But when we look at the number of positions that we have from December of 2023 to currently, we've had a net loss of a little bit more than 5 positions. Some of those, they may have been open positions that continue to may not have been renewed, but we do know of a couple of places, and I'll give an example in operations where we had a retirement. We just eliminated that position and then moved his folks into other divisions, and it's actually working a little bit more efficiently even. So part of that is a loss of FTEs intentionally. I will say this, these are the number of FTEs and not the number of filled positions. So they're not fully staffed, but I can get that number for you if that's something that you'd like to see. So let's have the conversation, on what's working and what maybe needs a little bit of improvement. First of all, you've met with these directors. They do a fantastic job. They're committed to making sure that the departments are off and up and running, and even though it's been a heavy lift, we have an integrated support system. And with the three departments and the three department secretaries working directly with OSA, that has been a benefit because they also have that institutional knowledge. They have been there far before the three secretaries came to be for the departments. So they're giving us that historical perspective of learning how to do budgets and learning how to manage HR, how to use communications both internally and externally. So very important functions that they are doing to keep us going. So having that as far as building out the departments, having that historical knowledge has been very, very, very good. The structure and function of most of the offices, and I'll go over which ones were more impacted and which ones were least impacted. A lot of them, the way that they were structured within OSA, it hasn't been a change to have three different departments to report to or three different departments to navigate to, because they had the overarching piece. That being, operations had a few shaky things at the start that were hard to deal with. When you look at MIS, they were already a centralized department for 2 years. And when you look at, the day-to-day functions, many of the things had not changed, with the exception of three that did have the heavier lift, and I'll talk about those in just a minute. But, we're committed to looking at more efficiencies. I can give very specific information onto some of the efficiencies that we found in the things that we've been able to work on so far. What still needs work? The impact wasn't proportionate to each of the shared offices, and the hardest one has been finance. No, operations, I'll get into the details as to why they had a little heavier lift in the beginning, but things have probably been righted on course now. In OHRN, finance has had the biggest impact as far as really having to make the changes. And we're going to need some time to look at that, but I'll go into more detail. That's really the only thing that I can say is that while they are still within OSA, is that they all have a very important function, but it hasn't been a proportional lift as far as serving the three departments. The Office of Finance does continue to have some of these impacts, so we're going to work hard at trying to do little things to make it a little more efficient, and there may need to be bigger changes down the road. Again, we locked in for our departments beginning January 1st. We had 6 months of runway to take off for the OSA, and we've really only been locked in for 70 days. So, there was a saying that I like to use during different jobs, that semper gumbe, we're flexible. We're willing to change and to make these changes to make them work moving forward. So let's talk about the Office of Communications. In communications, a lot of people think that what they do is, they do have forward-facing communications. They do our social media, they do our press releases, they make announcements, but they do a lot of internal reviews as well. So any PowerPoint that goes out for someone doing information at a conference, or any information that goes out to the public, it is vetted through communications for fact-finding. It is vetted through communications to make sure everything is consistent, because we want to make sure that the message going out is consistent and that is appropriate for whoever is receiving that, whether it be press inquiries or anything that it does affect the public. We want to make sure that we have programs that they are aware of, and without communications, people may not be aware of some of the things that may be of benefit to them. When we look at the number of FTEs, when we started with shared administration, we had 5 filled FTEs. Currently, we have 4. And the way that not everything is proportionate. It would be great to say we have split into 3 departments. We all 3 have the same demand signals, and all 3 have separate needs. Everybody gets 33%. Unfortunately, the demand signals are a little bit different. And so of having 4 individuals in communications, 2 of them are dedicated into human services, again, to get down into that bureau and office level to get that information out. And the same thing, having 1 technically for health and 1 for health facilities as well. We feel like that is a great way to be familiar with the programs, and so that they can be subject matter experts in communication and knowing those programs well. We also are continuing with the Department of Commerce on the rebranding piece. We are still working on website design and getting information out, making sure that landing pages are appropriate, making sure that we have active links, and it has taken some time. There's a lot of information and a lot of depth to our external information, and that's something that they continue to work on with communications. Constituent services. This constituent services was really one of our least impacted as far as being able to provide services and provide support for all three departments. We all know John Lopez. Again, we call him for issues both internally and externally, but he knows how to navigate down into each of the bureaus and the different levels to get things that people need. Asking him very directly, what impacts have you had? He felt like the way that he had it previously designed, he was ready to go. He feels like he has no more needs as far as being able to write course, and he has good staff, and he's well staffed, and the people who work for him like him. Of course, it's John Lopez, so he does a great job for all of us, and he continues to do that moving forward. Office of Finance, that is the harder piece of the discussion today. And so while they are responsible for planning, coordinating, safeguarding, making sure that our budgets are appropriate, there's been some issues as far as it's been a bit of a heavier lift for the Office of Finance. And part of that is that when it was all one location for DHHR and you had one central finance, even though the departments had their own finance, it's still broken out into three separate budgets. That's three different demand signals from three different secretaries, because we want to be forthcoming. We want to be prepared for our budgets. We want to give you the information you need so that you can see what we need within our departments when we come to you and we make those asks, and preparing things like our supplementals and our improvements and things. Those are time sensitive, and those can be hard demand signals because now it's not broken down into one, it is broken down into three. We think that we have a good operational rhythm, and the three secretaries have respect of each other and respect of each other's departments, so those pieces we are making it work. Some of the things that has set finance back, though, just to kind of paint a picture, that the first 6 months going from January to preparation for OSA and preparing the budget piece, is that unbraiding all of that funding, because we still have offices within different departments that have functionality with each other, and some of those are tied to dollars. So I'll give an example. In Department of Health, we have birth to 3, and they have essential services that we cannot let go unserved to the general public because they're serving babies, they're making them better. But part of our funding is tied to Medicaid, and so to be able to unbraid that and untangle that to get it to where, most importantly, we're not disrupting the services. But that's one example out of several offices, several programs and things. And the good thing is that with the split and, with the formation of OSA, we're taking out those pieces so that you have better visibility. It's not one big, huge budget, but each of those are a creation. I like to think of it as, with government finance, it's a little bit more complicated. It's not like we had one bank account and we can just take the cash and put it into the 3 separate bank accounts. It's more complicated. To their credit, this is very difficult work that they're doing. And again, this is not to say that any of them are not doing great work. It's just been a lot of work. It's been a taxing on that office, just more disproportionately so than others. But you're not taking one big account, creating 3 separate accounts. You're creating line items out of several little accounts that are directed towards offices. The great thing is it gives more visibility, but that unwinding piece has taken a lot of time and a lot of effort. Hopefully, we're kind of writing the course. Some of this stuff that's been a heavier lift up front, now we're locked in. Now we've got this piece over with. Now we need to go back and say, what can we improve? Again, another example, beside the unblending of the funds, we had to have new UEI numbers. Even if you had a program, and just very specifically, I'll use birth to 3 again, you receive federal dollars for birth to 3, and their MOU, we had to have a UEI that was used for DHHR. We had to go through a whole process to make sure that we had the correct UEI, change it. It was a document that had to be signed by the governor. It went back, came back, it's approved. But it's still a process just to get some of the paperwork changed to make sure we're in compliance with federal government regulations to receive funds, because their work was with DHHR previously. Now their work is with the Department of Health. So while these were seemingly mild things. It was just a lot of mild things that kind of culminated to some of the backlogs. Again, we have contracts with other governmental agencies. We experience payment delays with Office of Technology, the AG's office, DOP. They all have different platforms, things that we are still continuing to work through there. We have started with some of the quality improvement and some of the additional tracking processes. This year, as of July 1, we do a grant risk assessment so that we can have programs fill out a paper that basically, it's kind of an auditing function, but is this grantee at risk? Do you feel like they have all the tools that if they execute it, that they will invoice and be able to work through that piece of the grant? It's an extra step, and it is a little bit burdensome on the programs at times, but it does give us a little bit more visibility that if we see that there's potentially a problem, that we don't give grants to those who maybe don't have the resources to execute it. So we're not wasting dollars or trying to claw back those dollars, which can be a little bit difficult at times. And that grant review process is very thorough at the OSA level, that we could do a little bit more of that down into the departments. These are fine-tuning things that hopefully we can take care of a lot of them internally. But after that, and we reassess, that's when we may be having a different discussion, and that's when I would love to be able to provide updates as to where we are and what we're able to fix efficiency-wise. Human resources, they had a bit of a heavy lift too, and I list them as one of the top 3 being impacted because your benefits and everything changed from one DHHR to, again, going into the 3 different departments. Even how they list the open positions has been a change, so all of that needed to be changed. The good thing is that those changes have been made. We're doing good. OHRM is doing some really cool things that if you have the opportunity, if you'd like to come and talk to our directors again, Angie Ferris, she and her group, they've improved technology integration, and a couple of the things that they're doing, I made notes here so I wouldn't get this piece wrong, but they are doing they have a survey for employees that typically before, when you had a job with DHHR, you might get a survey at the beginning of the job. You've been interviewed, you know how you're doing, and then they do an exit survey. This is an automated survey process that makes contact with the employees throughout the time span that they're there. So if something's not going right, they have that opportunity to share so that we can right course and keep the talent here, so that we can keep the talent, keep these employees, and make things right for them, which is so important. We hate to lose talent. We hate for things, because, so many of these programs are so large, you may not have visibility on each and every one of those things. This is an opportunity for us to keep and retain folks. They also have FMLA tracking, which we didn't previously have, so we can see who's on FMLA, the family medical leave, and who isn't. And then we also have a mentorship program. One of the things that I'm very proud of from the department's perspective and from OHRM is that we need to train the people behind us. We need to have redundancies there in knowledge so that they can, so that we can be training the people behind us, and to have that mentorship and to be training folks within the departments, I think is very valuable. I see 2 people who trained me as a physician, and those mentorships absolutely mean a lot, and it's something that sticks with you. So having that mentorship is very important. And we have had the discussion too of, do we or don't we? Do we keep OSA? What offices work? What offices don't work? Very specifically for OHRM, one of the things that's a challenge for them is that, yes, they have 3 benefits coordinators, which if you get hired, they get your benefits in place, and they make sure you get your paycheck, and they make sure that you get your insurance and X, Y, Z. And it sounds like it would be okay to take those 3 benefits coordinators and put 1 in each of the departments. However, if they didn't have that lateral ability to communicate and help each other, that one person in each department could never take vacation, never get sick, and so on and so forth. So the centralizing piece of it, a lot of it is working well. We just have a little bit more work to do with finance. For MIS, and asking Sean Charles, what are your needs? What could we be doing from the OSA perspective? Is there any work needing to be done with any specific department? They centralized about 2 years ago, so operationally they've been able to consolidate and provide coverage for all three of the departments without any major disruption. So happy to report that they're doing a great job keeping our computers on, keeping us communicating, and keeping our outward-facing information moving as well. With that, I just want to kind of go back to the overview. Oh, I'm sorry. This is operations. Then I am done. I apologize. Operations. They keep us in buildings. They keep us safe. They do our fire drills. They make sure that there's not mold into the basement. Things that we take care of on a daily basis. They did have some issues because they have a lot to do with the procurement process. We went from having 2 tax IDs, which I'm not sure why there were 2 for one DHHR, but we do have 3. And so everything had to be changed, even the notary seal that goes onto the documents that we had. That's fine. Those pieces have been worked out. Operations is doing well. They again, keep us safe. Operations, we've had a couple of one retire, and we've been able to reallocate those positions that were underneath the manager and eliminate a position so that we invest more at the program levels. One thing with operations, they do have part of our real estate and specifically to the Department of Health, but we take these opportunities. We found a satellite office in St. Albans that wasn't well staffed. We brought those people, they were in environmental health, we brought them back to the Bureau with us and had a cost savings of $40,000, which over time does make a big impact. We take those opportunities when we see them, and the better visibility and the work that everybody's doing to help with OSA and to help within the departments, the more of those opportunities that we'll have. So again, I'm just going to kind of summarize by saying that we have wonderful folks that work for us. The people in OSA do a great job of trying to keep us going. They've had a heavy lift. I want to say that even though we've had challenges, it's not due to one individual or nobody's looking for work to do over there. It was a little burdensome on some folks. I think we've righted most of it. We still have some work to do within finance, and hopefully the next time that we speak, I will be able to give you an update as to how even those have improved even further. But with that, I thank you for your time.
Thank you very much, Dr. Young. Does anyone have any questions? Did Dr. Rohrbach leave or just out in the hallway? Okay. If he comes back, we'll have a quorum. Any questions? Delegate Height?
Now that the split has taken place, can you tell me, and let's just talk about health, that's one you're in charge of. Are there any duplication of services that shouldn't be there? Does the health department have, per se, a finance person, an IT person that's outside of the Office of Shared Administration?
There are different departments, but there's no duplication of the services piece. So those departments of finance, that is one of the places where on paper it may sound like it's a lot of, finance is not always finance. At the programmatic level, down in the department, they are working with programs going door to door every day saying, do you have your invoices? Do you have the information put into the system so we can pay vendors? The process to get grants approved is all done within the department level. If we tried to put that into OSA, it wouldn't work. We wouldn't have the bandwidth to put it all within OSA.
So that makes sense with finance. How about the communications, the IT, other areas like that? Are there duplication of services still within the departments themselves outside of OSA?
No, sir. So while we have structured them a little bit differently, MIS is kind of one pocket that lives within OSA. They will deploy their needs, and they have people who work down into the programs, but they all report up into one place. There's no embedded MIS folks there. Communications, we did structure a little bit differently. Again, it was so that we'd have subject matter experts and to be able to convey that information more accurately. There's no redundancies there. We know that DOHS has a heavier lift, so they have 2. Maybe they need 3 with us. Our communications, we actually share the 2 individuals between the communication director and the 1 employee for health and health facilities. For operations, no, they are centralized. They work a lot because not all the real estate belongs to us. They do work a lot with Department of Administration, but they work well. To give an example, like for We had some issues at BPH, and if you've noticed, there's a lot of construction around Capitol Street, but we're working with them on those issues. There's no duplication that we can see there.
Thank you, Madam Chair.
Here. Thank you.
Any further questions? Delegate Tully?
Thank you, Madam Chair. Thank you for being here, Dr. Young. You mentioned the finance seemed to have a heavy lift in the very beginning of, the separation. Do you anticipate that as they get things straightened out and the budget is divided and the separate line items are done, that the workload will alleviate and be a little bit more manageable for those individuals?
I do feel like we're on a better course because a lot of that is one-time creation and then getting used to having things where there will be no need to change the accounts again or change the names again. It is a little difficult. I mean, the demand signals of 3 different departments, we obviously have very, very different size budgets, but for example, health needs a little more help because of grants. So I'm going to help take the initiative when we get back. What from grants can we take out of OSA that we can be doing for our folks in the Department of Health? But finance is the unsung heroes. Staffing can be a bit of an issue. There is a nationwide shortage on accountants, and it's hard to get them right out of school. I will say this, and this actually goes partly to OSA, but definitely to Danny Thompson in Department of Finance. In Department of Health Finance. But we've had some internships where kids come in and they spend the summer, and they love it. They love the atmosphere, and they see us working together and things. And so we're recruiting people, hopefully very young, that we can keep within the state.
So one of the things when you mention that, I kind of wonder about the State Department of Education are there opportunities for high school or even working with career and technical colleges that maybe we could start to do some programs to mentor them, to bring them into some roles, to fill the needs like finance, if you have some accounting technology individuals, the more technical piece of that. Have we looked at it doing any of that, or would that be a possibility in the future?
Yeah, I love that as an idea. We have worked some with the universities as far as trying to do some recruitment events targeted towards universities, but I agree that's a great idea. Let's go even younger. Let's train them young and get them in.
Thank you.
Thank you.
Thank you, Madam Chair.
Anyone else? Can you just clarify for me again? I have one thing. So operations is centralized, MIS is centralized, human resources, finance are in the Office of Shared Administration, and then in the departments they have people that are additional people. Constituent services and communications, did you say those are centralized or in the departments? I forgot.
Communications is in one large location.
Okay.
John has a lot of folks in his department. They work well together and they get the information done. Again, they haven't had much of an impact, but yes, they are all centrally located. And with OHRM, they do have a central location for the department, for OSA leadership within OHRM that we can communicate with daily. But we found that if they have some HR presence down within the programs and they have issues, they don't tend to bubble up as much. So that structure is, while they live in OSA, but sometimes down into the departments, they can have a little visibility that they wouldn't otherwise.
Okay, thank you.
All right, thank you.
Is there any other business to come before the committee? Chair looks to the co-chair.
Thank you, Madam Co-Chair. I move we adjourn.
Move to adjourn. All in favor say aye. All those opposed, no. Thank you very much. We're adjourned.
Thank you.
We have the best news in about 15 minutes.
In front.